Hello, Margaret, and hello to all of you nurses who are considering applying for a J. Patrick Barnes grant. I am delighted to have a conversation today with the chair of our grant review committee, Dr. Margaret Barton Burke. And Margaret, why don't you please introduce yourself and we'll take it from there.
Thanks, Bonnie. This is a great pleasure for me, not just to introduce myself, but also to spend some time talking about the grant applications that we're going to be doing for the DAISY grants. So I'm Margaret Barton Burke. I live in New York. I work for Memorial Sloan Kettering Cancer Center. I've been there for 7 years. Officially, next week makes it 7 years. I have had my practical experience with grants in academia as well as in other clinical settings. I have worked in Boston, a variety of hospitals in Boston, a variety of academic centers in Boston, as well as University of Missouri, St. Louis. And from there, I came to Memorial Sloan Kettering Cancer Center. I do some extra grant education, I guess, at some communities or universities around the city of New York. So speaking about grants and grants applications is not unfamiliar to me.
And your expertise in reviewing has become very evident to me over the years as we've worked together, and we're very grateful for your volunteering to help us with this very special program for DAISY. The reason that the DAISY Foundation actually makes grants is that as part of our overall recognition of nurses and our gratitude to nurses, in 2010, we decided that it would be important for us to help nurses elevate their knowledge and give them even greater confidence in their practice through the disciplines of research and evidence-based practice. And so we launched, in memory of our son Patrick, the J. Patrick Barnes grants for nursing research and evidence-based practice. And we focus them on treatment of patients and families of patients who have cancer or autoimmune disease, since Patrick had both of those during his 33 years of life. So that's a little bit of the background in what we do. And one of the things we felt was really important was that the grants be available to nurses, whether they were highly experienced researchers or real novices to the discipline of research and EBP. We want to encourage clinicians to get their questions answered in a structured way, to contribute to the overall knowledge of nursing. And we want to make that available and provide resources to nurses at every level of experience to make that happen. So, Margaret, maybe we could start with a question about, for novice researchers who really don't have a lot of experience, why is it that we believe that a mentor is so important to them?
I really think that this is a key for anyone who is applying for a grant. Whether you're a novice or even more senior, you always have people who you should expect to read your grants. What happens with a mentor, and I think that this is very important for DAISY, our DAISY grant funding mechanism. When you have a mentor, that mentor will guide you through each step of writing the grant, from letter of intent, which is what our first step is, to moving on to the whole proposal development. A mentor really needs and has the expertise to give critique to the person. And I maybe should add one other point. From reviewing many of the DAISY grants, sometimes we see that a mentor is named, but it appears that there's no interaction between the person who's writing the grant and the mentor. There seems to be pitfalls in the proposal process. So when we're reviewing, we're saying, maybe the mentor was not actively involved. Maybe the mentor was not contributing in a different way, or needs to contribute in a different way. And I think that that's one of the purposes for us doing this interview, is to ensure that when you have a mentor, you really work with whoever the writer is of the grant, really works with the mentor to establish what I would call a tight grant or a logical grant, a grant that fits together, all the pieces fit together.
A mentor can have a really objective view of the story that's being told, right? And identify the gaps where it's not complete, and see some common errors that might be being made that a grant writer may not pick up on when they write it.
Right. And a good mentor would be somebody who helps them start to think about what they're writing. And I love, Bonnie, when you said tell a story, because I think all writing should tell a story. And in doing that, the reviewers who, I sit on the review committee, I chair the review committee, but all the reviewers will know the story. So what the writer of the proposal needs to do is really tell their story in a very logical, thoughtful way.
That makes a lot of sense. Margaret, sometimes we get applications for evidence-based practice projects that are written in research language. And we get the feeling that maybe it isn't clear what the difference is between the two. And they're really very different. Can you give me a simple way to think about the difference between research and evidence-based practice?
Evidence-based practice many times comes from the literature, and you bring that practice that has been tested and then published in the literature to your clinical area. That's an evidence-based practice project. But evidence-based practice projects, when there's not enough evidence, should fall into research question about the lack of evidence.
I understand. Thank you. So the research is adding to the knowledge, and evidence-based practice is bringing the knowledge that's already been established into your own setting to see how it works and how it improves care. So you mentioned before that we have a letter of intent. That's the first step in applying for a J. Patrick Barnes grant. Tell us what you are looking for in the letter of intent and how it's different from the full application.
I think this is a wonderful question. And the reason I say I think it's a wonderful question is because once upon a time, I learned that when I didn't put enough information into a letter of intent, I didn't get asked to write a full proposal. And I started to realize, wait a minute, a letter of intent really tells me, it's a snapshot of what the question is going to be. The aims may be strong, they may not even be present, but it's the question, it's the concept or the idea behind why this study should be done. Therefore, somebody could write, there is not enough evidence or evidence base in the literature, therefore we need to write this proposal. You give an idea of what rationale and or use you'll do, or methodology, I guess I'll say, what methodology you will be using in the study and what you're looking for outcomes. But I think the other thing is that it all follows through, that you've looked at the literature. There's a gap in the literature. Therefore, you have this question that needs to be answered, but it's not in the literature. You need to use a certain methodology. And I think that that's a key. Don't leave that out. You might say the population you're going to use. You might say the area you're going to study, meaning the population, the area within a hospital or a clinical setting, community setting. And finally, what you may not get into analysis in the letter of intent, because that's really goes into a proposal, but then the outcomes. What are you really looking to do with this study?
Got it. Thank you. That's really helpful. And because we are Daisy, of course, and we're completely focused on the profession of nursing, one thing we are looking for in that letter of intent is a checkbox that says this proposal is being led by a nurse, by a registered nurse. And there may be other members of the team, the research or EBP team, who are not nurses, and that's fine, but we want to know this work is being led by a nurse.
Don't we also ask that the team have to include clinical nurses from the area that you're working on? So when you're writing your letter of intent, you also need to include who's your team, who's your research team.
Yeah, thank you. Exactly what I was going to ask. What are you looking for in the team? Because it seems to me that what you've been looking for is a team of expertise that will be able to deliver on the grant, deliver on the project that's being done or the study that's being done. And
Correct.
thank you for mentioning about the importance of clinical nurses. That is near and dear to our hearts. This is even when we have our funding PhDs who know a lot about research, we insist that they include clinical nurses on the research team in a very meaningful way. And that's something you're looking for as a reviewer too, isn't it?
Absolutely. This is a grant that can give the data needed for the next step in a research program.
Thank you for mentioning that, Margaret. We have seen that in numerous of our studies that have gone on to be NIH proposals and funded by, the rest of the work is done because they were able to get started. And we're so happy to create that spark and the basis for which research can go forward. So once a letter of this,
1 minute though,
please, yes,
they asked me a question about a more senior researcher
yeah,
bringing along junior
mm,
scientists or staff nurses. And I
yeah,
think that that was why I made this mention, that many times we would like to see, we've seen, but we'd like to see more senior researchers apply for these DAISY grants, but also then bring along the staff nurses that who they can then teach research to.
right.
And then the staff nurses can actually probably be their data collection staff on for the grant. DAISY is a great opportunity for both the senior researchers as well as staff nurses. And we
Absolutely.
want them all.
Thank you. We do. We absolutely do. So once a letter of intent is approved by you and your review panel to go forward to full application, can you just mention a few of the qualities of a successful or what we call fundable application?
All the pieces of a grant are so important. I think where we spend time and where anybody writing a grant should spend time. I spent some time yesterday with some folks at MSK trying to teach them about writing a grant. And I said, the first thing that we have to do is figure out what the question is that we're going to answer, or what is the purpose of your grant? And I'm always looking for what's the purpose of the grant. From that, I then want to see logical aims, and aims are really different than the purpose. The purpose is a general overview statement. Aims then become the very specific things that an individual will do in the grant. So they'll look at demographics for a certain population, or or they'll look at other variables for within the study. But those aims then become very specific, very measurable. From that, they will then go into a literature review, and the literature review needs to be current unless there are seminal works and like original works that really need to be cited. But they can't be, 10-year plus. Some people even look at 5-year plus the age of studies. That doesn't tell us that the person who's writing is current or has looked at the literature recently. So we look at not just the writing of the review of the literature, they have to identify the gaps, but when did they look at the literature and who are they citing? Again, I would say seminal. I love seminal work. I would also tell people to look at review articles. Review articles summarize everything in one article, but current review articles really are a good way of jumping off and identifying the literature. From the literature review, we go to methodology and or design. Some people, I usually call it design, because in that is included what's the setting, who is the population you're going to study, and you have to also tell us how you're going to have access to that population. So if you want to study 100 patients that are receiving bone marrow transplant, but you work in the community part of the hospital or the ambulatory part of the hospital and have no access to that population, you have to tell us the link between how you're going to do this work. That's when I talk about the logic of when we're reading the grants. I think the other piece from after methodology, okay, so what instruments are you going to use to measure the variables that you've cited in the aims? Again, if you can think of logic being pulled through the whole proposal, that's the kind of thing that we're looking for. Okay, what are the aims, and then how are you going to measure those aims? And that's usually with instruments of some sort. And they can be qualitative or they can be quant. And so again, this is not, the proposals that we fund are not of one sort or another. They're not different. And by that, I mean quality or qualitative or quantitative, but also we don't only look at bench science versus psychosocial science. We look at all proposals in this way. After methodology, you move on to analysis. And then I always have anybody that I'm writing with talk about the outcomes of the study at the end. For example, I would expect that everybody, and this is just an expectation of my thinking, but I know it's my whole department at MSK. If you're writing a grant, if you get it funded, you do the work, you present the findings, and so they write that in. They should be thinking about writing that in the proposal, and then they're going to publish those findings in peer-reviewed journals. That's the whole process that I would be looking for. But what we really fund is all those first steps that I talked about.
Right, because as you know, we do not ask for cost of presentation, poster production, any of the dissemination of findings to be included in a budget for J. Patrick Barnes grants. All of our grantees who are funded by us are entitled to an additional $2,000 if they are approved to disseminate their findings at a nursing conference. So that's a separate grant. We call it Lindahl grant. Another story, another interview. But yes, we do expect and hope that dissemination is going to be a key part of this work. Right.
Absolutely.
Speaking of
notation that this was funded by a DAISY grant.
Always. And we aim to get this work done within a year, right? We're not looking for multi-year studies here. We're looking for projects and studies that can be done in a concrete period of time. And while we expect that extensions may be required over time, and we certainly approve those if they're explained to us, we aim for a 1-year timeline, right?
Absolutely, the 1-year timeline. I think the other piece that then goes back to what you asked me just a minute or two ago. So don't make your aim, don't give us 10 aims in a study when you know you only have 1 year to accomplish. Make your aims very reasonable. They jive with the goal, but then also make it so that you can accomplish the aims within 1 year. I would say 2 to 3, but not more than 3 aims. And they should, again, all fit together.
Right. And in our case, we actually don't write a check to fund a grant until the IRB is approved. So our start date is upon our approval, and it's a year after that. So what happens after a study is reviewed and you as a panel all get together and I listen in and take notes and then we communicate back to our applicants? What can they expect to hear from us?
Can we take a step back, a little step back?
Of course.
We have a great review team. This review team has been in place before I became your team. Exactly, for years. One of the things that we have done is that they actually help review the letters of intent. What we do is have Margaret and somebody from the review team reviewing specific letters of intent. But then when we decide to ask somebody to come to full proposal, the person who read the letter of intent also then gets to review. So they've already got in their head an idea of what they read in that letter of intent. And then they can move on to really looking at how that person fleshed out the whole proposal. If you want to think of it as skin and bones, the letter of intent is the skeleton. The proposal actually starts to put meat, bones and muscle on those bones, so that you really do flesh out. And that these are terms that we use. We call about fleshing out the proposal, but you have to do that so that, again, it makes sense. I think when we get together as a review team, so we give plenty of time for letters of intent. We also give plenty of time for our team to review the proposals. And sometimes we fund outright, but many times we ask more questions. Okay, we think that this is a fundable proposal. But we had a few other questions, how they were going to, again, how would that nurse who's working in ambulatory actually survey those bone marrow transplant patients? And one of the questions, Bonnie, might be in your letter, okay, tell us how you're going to do that. Is there a connection? Do you work there part-time that you didn't tell us about? Things like that. Then as you write those letters, sometimes the letters come through. How can I say this? The answers come through, and then we say, completely fund. If we have more questions, we continue to ask more questions. I think that to me is one of the pluses of the DAISY Foundation in general, but it's also one of the pluses for the grant mechanism that I chair. By that, I mean, we don't just say yes or no. We offer opportunities for people to get it right.
Yes.
Maybe not only on the first time, we ask more questions. We really try to find out more about what they really can, how they really can do this work. Sometimes we ask about the mentor. Sometimes we've asked about how do why would you use so many instruments when in fact you only possibly need one or two? We give opportunities that I think other grant mechanisms don't offer.
I love that about the work that you all do. You are educating our applicants. And of course, I've learned so much along the way in standing by you. You mentioned something before that I think is really key. When you and our other reviewers review a letter of intent, you also follow up with feedback. And when you then look at the application, you're looking to see that the feedback you provided has been responded to. So I want to make sure that people realize, pay attention to those emails that we send back upon delivery of your approval for a letter of intent, because you're going to find the seeds of your approval of the whole application in that feedback you're getting from the reviewers.
We essentially give you notes or messages on how to make it successful.
Absolutely, absolutely. Yeah. And one more thing I would mention as I think about the process that we go through, we spend quite a lot of time on the budget of each of the proposals. And oftentimes people will be including things in the budget that we expressly say on the website we do not fund. Sorry, we're not going to buy you a laptop computer. So what I really urge, and I know you do as well because we talk about this, Margaret, is look at the DAISY website. The goals and guidelines of our program are so clear, and I will put up on the screen a reminder of what the website address is. But let's make sure that you're paying attention to what those things are that we will fund or won't fund, because we're going to take them out before we write you a check.
All the different steps, really, even when you asked about what goes into a grant and what we're looking for, all of that is on the website as well. Right. So you really should, whoever's writing that grant with their mentor, even before speaking to your mentor, you want to read the website for all the things that are important that need to go into the grant. And also then, like from a budgetary standpoint, what doesn't go into the grant.
Right, right. Well, Margaret, I can't thank you enough for your service to nursing and the DAISY Foundation's drive to help nurses advance their knowledge and advance their expertise through the practice of research and evidence-based practice. You are a gift and such a true friend to ours. I can't thank you enough. And thank you for your time and great guidance today.